Man, going for a minute now. So California Proposition 23, Dialysis Clinic Requirements Initiative. What would this ballot initiative require of dialysis clinics? Oh wait, let's do the yes, no. Yes. Supports this ballot initiative to require chronic dialysis clinics to have an on-site physician while patients are being treated, report data on analysis on dialysis-related infections, obtain consent from the state health departments before closing the clinic, and not discriminate against patients based on source of payment for care. A lot of those sound good. The one that doesn't sound good to me is having on-site physician while patients are being treated. And the reason it doesn't sound very good is because those people cost the most money ever. I don't know if you've ever noticed, but companies, one of the biggest expenses in companies, in any company, are people. Especially people with high ranks, high titles, and high positions. So this would make every dialysis clinic have to spend more money, probably going into the millions, because these people aren't paid chump change. They're not. They're paid decent amount of money. So you're going to force these clinics to probably even charge more, have to charge more, is my opinion. Let's keep reading though. No vote opposes this ballot initiative to require chronic dialysis clinics to have an on-site physician while patients are being treated, report data on dialysis-related infections, obtain consent from the state health department before closing the clinic, and not discriminate against patients based on the source of payment for care. All right, so basically everything up there. Okay, what does ballot initiative require dialysis clinics? Have a minimum of one licensed physician present at the clinic while patients are being treated, with an exception from when there is a bona fide shortage of physicians. A bona fide shortage of physicians. What is there an emergency where all the doctors are called in for some reason? No. State a licensed physician present. We're gonna have to see what the hell that means. Report data on dialysis-related infections to the state health department and National Healthcare Safety Network. Require the principal officer of the clinic to certify under penalty of perjury that he or she is satisfied after review that the submitted report is accurate and or complete. I mean, isn't everything you do always under the penalty of perjury? Provide a written notice to the state health department and obtain consent from the state health department before closing a chronic dialysis clinic. What if the state health department says no? The ballot measure would also state that a chronic dialysis clinic cannot discriminate with respect to offering or providing care, nor refuse to offer or to provide care on the basis of who is responsible for paying a patient's treatment. Oh, snaps. Interesting. So private chronic dialysis clinics cannot discriminate, even if they're private. It doesn't make a distinction here, so let's keep going. In 2018, rejected California Proposition 8, which would require dialysis clinics to issue refunds to patients for profits above 115% of the cost of direct patient care and healthcare improvements. Proposition 8 and the Dialysis Clinic Requirements Initiative were designed to enact policies related to dialysis clinics, but the specific policies are different. Proposition 8 would have capped profits and required refunds, whereas this year's initiative would address minimum physician staffing, data reporting, and clinic closure. I'm all for data reporting, but is there a problem with physician staffing where there's so many accidents because physicians are not present that we need this new physician? Do we need that kind of physician to always be there? I don't know. Proposition 8, like this year's dialysis-related ballot initiative, had the support of the labor union for healthcare workers. Oh, so they're a labor union for healthcare workers. No wonder they're in the other propositions. Proposition 8 established a new front in the conflict between the and the state's two largest dialysis businesses, DaVita and Fresenius Medical Care. The SEU was said that workers at dialysis clinics have been attempting to unionize since 2016, but that their employees were retaliating against pro-union employees. But that their employers were retaliating against pro-union employees. Okay. Kent 30, CEO of DaVita, argued that Proposition 8 puts California patients at risk in an effort forced unionization of employees. For the Senate, whereas the intended as the workers want these reforms regardless of what happens with their union efforts. I don't know if they do. The problem is we never really do what people, we rarely know what people really want, because our voices and opinions are not really out there in public. So when we say we all want this, no, we think we all want this. It's what we think. It's our illusion. So it requires at least, by the summary, requires at least one licensed physician on site during treatment at outpatient kidney dialysis clinics. Authorizes California Department of Public Health to exempt clinics from this requirement if there's a shortage of qualified licensed physicians and the clinic has at least one nurse practitioner or physician assistant on site. So yeah, the clinics still have nurse practitioner and physician assistants. They just don't have licensed physicians. That's just like another person that they're going to have to hire. Requires clinics to report dialysis-related infection data to state and federal governments. Why don't they already? What the hell's up with this? Prohibits clinics from closing or reducing services without state approval. Why would the state have to get involved in your business? And I know a lot of it has to do with Medicare, but pretty sure a lot of them are state-run. Prohibits clinics from refusing to treat patients based on source of payment for care. It sounds like they're trying to get into the private businesses here, because this is the only ones that would be majorly affected. Increase state and local governments cost likely in the low tens of millions of dollars annually. Yeah, more regulations probably. Let's check. Support Democratic Party and these fuckers again. Oh man. Let's go opposition. Republican Party. Boom. DaVita, I wonder why. Fresenius, I wonder why. California Medical Association against it. American Legion Department is against it. AMVETS Department of California is against it. Yeah. Following arguments in opposition. All clinics will require, look at this, no matter if they're located in a wealthy neighborhood or a poor, rural, black, or brown community. What's up with, why do poor, rural, black, why do you always assume poor, rural, and black and brown always all together? I don't get it. I hate that, the way they use that language. All clinics will be required to have a doctor or nurse practitioner on site. All clinics will be required to report their infection rates. Yeah, having a doctor on site, specific doctor for specific things. I don't think these people are having all these problems to need this. So why do you need a specific doctor? Again, the opposition clearly has the majority of funds. Clearly, because of DaVita and Fresenius, those two big ass, I guess, dialysis companies. And they don't want to get their funds capped, and they don't want to have to accept everybody for all their payments and stuff like I don't know. Again, this is the continuation of good intentions, but I'm failing to see where the execution would work out in any way, because all it is going to be increasing cost. And you can read these things yourself. Like, go for it. Patient care is protect us. Oh, some other stuff there, some other stuff there. Path. All right, let's keep going. So, probably gonna vote no. No on 23. No for me.